Imagine walking into a hospital hoping to get better, trusting the hands that hold your life in their grip. Now imagine those hands are not healing you. They're ending your life. This is a story of Dr. Ana Cruz, once known as one of Brazil's most dedicated nurses. But behind her calm smile and gentle voice lay a secret so dark it would shock the world. In a quiet São Paulo hospital, a string of unexplained deaths began to raise alarm. And at the center of it all, a woman who had taken the sacred Hippocratic oath to heal, to protect, to do no harm. Instead, she broke every promise. Because between 2019 and 2022, more than 20 patients died under her care. And one of them, patient number 17, became the key to exposing everything. What made a respected medical professional turn into a cold-blooded killer? Was it power, control, or something far more twisted? In the next 12 minutes, we'll uncover the truth behind one of Brazil's most chilling medical murders. A story of betrayal, deception, and the terrifying reality that sometimes evil wears a white coat. If you believe in justice, if you want to understand how monsters hide in plain sight, then don't look away. Stay with us until the end, because by the final minute, you'll know the full truth, and you'll never forget it. Don't forget to subscribe, leave your thoughts in the comments, and hit that notification bell so you never miss an update. Dr. Ana Cruz didn't start out as a killer. She was born in Rio de Janeiro, raised in a working-class family that valued education and service. From an early age, she showed a deep interest in medicine. She studied hard, earned top marks, and eventually became a registered nurse with a specialization in critical care. By her early 30s, she had built a solid reputation at one of São Paulo's most respected hospitals, Hospital Santa Maria. Colleagues describe her as meticulous, calm under pressure, and deeply committed to her patients. Families trusted her. Doctors relied on her expertise, and hospital administrators praised her for going above and beyond. But beneath the surface, something was wrong, and it began developing a pattern, one that would later haunt investigators. She worked long shifts, often volunteering to stay after hours. She requested specific patient assignments, especially those in intensive care. And when those patients died, she was always nearby. At first, no one questioned it. Death is part of life in a hospital. But over time, a disturbing trend emerged. The same nurse, the same unit, the same outcome. One death after another. And every time, the cause seemed off. Too many cardiac arrests. Too many sudden collapses. Too many times where only she was present. Hospital staff started whispering. A few doctors quietly raised concerns, but nothing was ever officially reported. Until patient number 17. This was not just another case. It was the beginning of the end for Dr. Ana Cruz. Patient number 17 was a 62-year-old man named Eduardo Silva. He had been admitted to Hospital Santa Maria for routine post-surgery recovery. His condition was stable. No life-threatening complications. Doctors expected a full recovery within weeks. But just 3 days after admission, he was dead. The official cause of death? Cardiac arrest. But something didn't add up. Eduardo had no prior heart issues. His vitals had been normal all day. And yet, at 2:47 a.m., during the night shift, he went into sudden cardiac arrest. Only one nurse was on duty in his unit that night, Dr. Ana Cruz. She was the first to respond. She performed CPR. She called for backup. Everything seemed textbook, except one thing. A junior nurse on duty later reported seeing Ana inject something into Eduardo's for 9 minutes before he collapsed. When questioned, she claimed it was a routine medication adjustment, but hospital records showed no such order had been given. Still, there wasn't enough evidence to accuse her. Not yet, but questions began to pile up. Family members of other patients started coming forward. They described eerily similar stories. Patients who were improving suddenly deteriorating. Mysterious drops in vital signs. Unexplained pain before death. And always, Ana Cruz was nearby. Hospital administrators ordered an internal review. They looked at patient records from the past year. What they found was chilling. Over 20 patients had died under suspicious circumstances, all assigned to the same nurse, all during her shifts. and all with one thing in common. They had no known medical reason to die. This was no coincidence. This was a pattern, and patient number 17 had been the first to expose it. Stay tuned. At first, hospital officials tried to downplay what they had found. They called it a statistical anomaly, a tragic but unavoidable string of deaths in an ICU unit. But the numbers told a different story. Between 2019 and 2022, over 20 patients under Dr. Ana Cruz's direct care had died unexpectedly. All were in stable condition before their sudden deterioration. None had prior histories that explained their deaths. And every time, Ana was the first on the scene. It was too consistent to be coincidence. So investigators dug deeper. They reviewed security footage from the ICU corridors. They cross-checked medication logs with patient records. And what they uncovered was shocking. Ana had unrestricted access to high-risk medications, drugs powerful enough to stop a heart if administered incorrectly. More disturbingly, she had been seen retrieving these medications outside of scheduled rounds. Sometimes alone, sometimes late at night. Forensic experts compared her actions to known cases of medical serial killers. Patterns emerged. She targeted patients who were elderly, patients with limited family visits, patients unlikely to raise suspicion if something went wrong. And when things did go wrong, she was always ready, always nearby, always the first to call for help. One doctor described it as too perfect. Another called it suspicious beyond belief. Then came the final piece of the puzzle. Toxicology report from several deceased patients revealed traces of potassium chloride in their systems, a drug used in lethal injections during euthanasia, and it wasn't prescribed for any of them. Someone had injected it directly into their four lines, and only one person had both the access and the skill to do it unnoticed, Dr. Ana Cruz. Now, the hospital had no choice. This wasn't just negligence. This was murder. For years, Dr. Ana Cruz operated in the shadows. She was respected, trusted, untouchable, but every monster has a weakness. And hers came in the form of a single junior nurse, someone who had the courage to speak up when no one else would. Her name was Carla Mendez, a recent graduate eager to make a difference. She started working on the same ICU unit as Ana just months before Eduardo Silva's death. At first, she admired her. Ana seemed experienced, confident, always in control. But soon, Carla began noticing things that didn't sit right with her. Patients under Ana's care would suddenly crash without warning. Medication logs didn't always match up. And worst of all, Ana never seemed surprised when someone died. One night, everything changed. Carla was assigned to assist during the night shift. Around 2 a.m., she walked into room 314, where Eduardo Silva lay unconscious. She saw Ana standing over him, injecting something into his foreline. Before Carla could ask what it was, Ana turned and gave her a cold stare. No words, just silence. Minutes later, Eduardo went into cardiac arrest. Despite efforts to revive him, he was pronounced dead. Carla couldn't shake what she had seen, so she started watching, taking notes, cross-checking medication records. What she found was terrifying. Ana had accessed potassium chloride earlier that night, but not for any patient listed in the system. She reported her findings to hospital supervisors, but instead of support, she faced resistance. Administrators told her she had no proof. Colleagues warned her to stay quiet. Even some doctors dismissed her concerns. But Carla refused to back down. She knew if she stayed silent, more patients could die. So she took a huge risk. She contacted an independent medical ethics board. And then, she leaked internal hospital data to a journalist investigating suspicious deaths at Hospital Santa Maria. It was the only way to make sure the truth got out. And it worked. The story broke nationwide. Public outrage erupted. Authorities launched a full criminal investigation. And for the first time, the world learned the name. Dr. Ana Cruz. Once the investigation began, it moved fast. Authorities raided Hospital Santa Maria and seized patient records, medication logs, and surveillance footage. They also searched Dr. Ana Cruz's home. What they found inside sent shockwaves through the medical community. Hidden in a locked drawer were handwritten notes, detailed accounts of her patient conditions, timelines of their deaths, and something even more disturbing, a list with names, and beside each name, a check mark. It was clear she had been keeping track, not just tracking deaths, celebrating them. Inside her apartment, investigators also discovered medical textbooks on euthanasia, lethal injection protocols, and case studies of infamous medical killers around the world. She had studied them, learned from them, perhaps even admired them. But what shocked everyone most, there was no sign of mental illness in her medical history, no prior criminal record, no red flags that would have warned anyone what she was capable of. So why did she do it? That question haunted investigators as they built the case against her. Anna was arrested without resistance. She didn't cry. She didn't plead innocence. She simply said, "I gave them peace." Her words chilled everyone who heard them. The trial that followed gripped the nation. Prosecutors painted her as a cold-blooded killer who abused her position to play God. Defense lawyers tried to argue she suffered from a distorted sense of duty, that she believed she was helping patients escape suffering. But the evidence crushed their argument. Toxicology reports, security footage, witness testimony, even her own journals, all pointed to one truth. Dr. Anna Cruz had deliberately taken lives, more than 20, and she had done it with precision, control, and terrifying calm. In the end, the jury took less than 6 hours to deliver their verdict. Guilty on all counts. She was sentenced to life in prison, stripped of her nursing license, forever remembered not as a healer, but as one of Brazil's deadliest serial killers. When the trial ended and Dr. Anna Cruz was locked away, many believed the story was over. But it wasn't. Not really. Because even behind bars, she continued to shock the world. Months after her sentencing, a journalist obtained exclusive access to prison interviews with Anna. What she said in those sessions would change how people saw her forever. She didn't deny what she had done. In fact, she admitted to more deaths than investigators could confirm. "I chose who lived and who died. It wasn't random. It was necessary." She claimed she targeted patients who were suffering, those with no real chance of recovery. But there was no proof of that. Only her word. And worse, she hinted that she wasn't the only one. During one interview, she looked directly into the camera and said, "There are others like me. You just haven't found them yet." Those words sent chills through the medical community. Were there other nurses, doctors, or caregivers hiding behind their white coats? People sworn to heal, but instead choosing to kill? Her case exposed a terrifying truth. Hospitals are built on trust, but sometimes that trust can be deadly. Anna's story is not just about one killer. It's a warning, a lesson in accountability, and a call for better oversight in places where life and death decisions are made every day. So what can we learn from this tragedy? First, never ignore red flags, no matter how small they seem. Second, speak up when something feels wrong, even if no one wants to hear it. And finally, evil doesn't always wear a mask. Sometimes it wears a uniform, and sometimes it smiles while it kills. Thank you for watching. Don't forget to subscribe, leave your thoughts in the comments, and hit that notification bell so you never miss an update. Until next time, keep searching for the truth.